Orientation in the sagittal and coronal planes. I now introduce the probe in the sagittal plane and keep the probe pointing downwards and posteriorly, ensuring that the endometrium and cervical canal are shown along its full length. If necessary, adjust the depth of field, then zoom to ensure that the uterus is centralized. I now optimize the gain to achieve an even image throughout the depth. I now freeze the ultrasound image. I capture an image and keep the ultrasound image frozen. Orientation caudal to cephalic. I now draw an arrow on the ultrasound image from the caudal end to the cephalic end of the patient. I keep the ultrasound image frozen. Orientation anterior to posterior. I now draw an arrow on the ultrasound image from the anterior to the posterior abdominal walls of the patient. I unfreeze the ultrasound image. Rotate the probe into the coronal plane. Remaining in the sagittal plane, I locate the uterus on the screen. I then rotate the probe into the coronal plane, making sure that I rotate it in the direction of the bladder to maintain the correct right to left orientation. I now locate the position of the uterus in the center of the field of view. If necessary, I then adjust the depth of field, then zoom to ensure that the uterus is centralized and occupies between 40 and 60% of the field of view. I then freeze the ultrasound image, I capture an image, and then I keep the ultrasound image frozen. Identify the patient's right and left sides. I now draw an arrow on the ultrasound image from the patient's right to the patient's left side. I keep the ultrasound image frozen. Orientation caudal to cephalic. I now draw an arrow on the ultrasound image from the caudal end to the cephalic end of the patient. I then unfreeze the ultrasound image. To complete the scan, I withdraw the probe, taking care not to exert too much pressure on the patient.